Babs, I got a call I needed to answer, so forgive me. So yeah, if you are, oh, I was answering that person's question. So if you are taking anticoagulants like Coumadin, definitely you don't want to take it. If you are taking apixaban, Eliquis, please stop taking it at least 2 days. Your doctor may say 24 hours before, but I will tell you this, to be on the safer side, 2 days. There's another medication. That one is red and it's like triangular shape. What's the name of it again? Anything that has the probability of causing you to have bleeding, don't take it at least 48 hours. So you probably should have stopped taking it Friday. If your procedure is Monday, the doctor may say stop taking it today. I will say stop taking it at least 48 hours prior. Aspirin, Coumadin, Eliquis. What is this medication? Guys, if you're a nurse and you know the one, it's red. It's usually 20 milligrams. It's red and it's small and it's triangular shape. Yes, so we are talking about the colonoscopy. Someone asked previously that what if you are taking your medication? What is the process? If you are taking anticoagulants, the risk for colonoscopy is perforation of your tubes. Another risk is bleeding. If you have AFib, for instance, your ventricles need the anticoagulant to help Xarelto. Thank you. See, that's why I love my Facebook people, because they don't leave me hanging on, or and feeling lost. So Xarelto, it's a deadly anticoagulant. Xarelto is a deadly anticoagulant. So Xarelto, Coumadin, these two, Eliquis, please. NSAIDs, even NSAIDs. If you take NSAIDs like Aleve and all those medications, quit taking them at least 48 hours. That's good morning, Miss Ari. That's what I would tell you. Stop taking it 48 hours prior to your procedure. So this procedure I'm going to do is colonoscopy. The guideline is at 45. I'm repeating myself because this is a new live on YouTube. At 45, you must do it. Why do they do it? They do it to check your risk for colon cancer. I don't have those risks directly, but also probably directly, because my uncle passed away from, he is aged, and I'm sure because of lack of this screening too. So once in a while, I wish I have another device here to give you the statistics of the how often does people, like the epidemiology, how often does people get colon cancer or even non-Hodgkin's lymphoma. So my uncle, my mother's direct brother, him and my mama, one mother, one father, he had, in later part of his life, 80s, late 70s, 80s, he had non-Hodgkin's lymphoma. So cancer is never in my home, but that's the first incident. So guess what? That could be part of lack of screening. My mom never had colonoscopy done. A lot of things that our parents in Africa have not done, and they are there. You would think, oh, but they are doing well. Sometimes it's lack, sometimes it's lifestyle, sometimes it's the opportunity to have screening early so you can get it detected and treated. So I think it's a good thing to do your colonoscopy. What is it going to do? Like I said, it's going to check your risk for colon cancer. What happens when they see polyps? They will see polyps. So just like they see, you go and see, I did my mammogram. I've been doing my mammogram since I was 49, right? Because I have unusually thick breast tissue, and that is very normal for me. That's my baseline. So it's important for you to do it so you know your baseline. Your blood pressure, know your baseline. Your sugar level, know your baseline. So if you know someone will come to the hospital and their blood pressure is probably high. Whilst it's not good, it puts you at risk of stroke and other things. Is that the person's baseline? No matter what you do, it doesn't go down. When they check their labs, they check their CBC, BNP, or CMP and all those things. What are the level? What are the numbers? See what I'm saying? Yeah. So you always know your baseline. your blood pressure, know your baseline, your colostomy number, cholesterol, your LDL, your HDL, your total cholesterol. What's the other one? It's another number, another, another one. And then the ratio, know the baseline. So you always have your labs done. When I was in acute care, every 6 months, I just took myself to the hospital and did HIV lab, did lipid panel, not just lipid is cholesterol, did what's the name, hepatic panel, and did some other one too, so I can check I'm not exposed to any kind of what's the name, hep C, because you are exposed to blood a lot, needles, stick, a lot of things. So I was just doing that just to be on the safer side for myself. You get it? So if you haven't liked yet, help me subscribe to YouTube. If you have not liked the video, like it. Thank you for the person that liked. So yeah, like I said, there are people like you and me walking and they have the pouch. You will not know, but they have it. Imagine if you have to go to the beach with that person. How would they feel? Would they want to get in the beach? So it makes you become body conscious, and it's in nursing diagnosis. They call it altered self-image. You understand? It affects your self-confidence. If you are single, God forbid. Yes, I said God forbid because that puts you at risk of wanting to be with someone. How would the person treat you if they get to discover that you have that? You see what I'm saying? It's going to take the mercy of God and the beautiful hearted person to not judge you and want that. You see what I'm saying? Even in this world we are in today, if you are a single mother, you're already at risk of the perceptions men place on you before they consider you as a life partner or as someone they will want to know. When they come not genuinely. They come undercover just to test you. You understand? So it's like you're always on the guard instead of relax and give people chance. You're always questioning people's intention, like what now? What is this one to up to now? So it makes you, unless you are just, I don't care, they can use you and go. But if you are like some of us, you always careful how to not avail yourself to people to be in and out, because it's not a good thing. Personally, I don't know about you, to be mixing your spirit and getting intimate with everybody, especially when they come, they don't want to use condom and you want to be intimate. That's you. But if you don't want to be intimate, protect yourself, because you could be exposed to anything, including the person's spirit. You'll be mixing your spirit with the person. The person could have HIV, the person could have hep C. We all worry so much about HIV, but these days HIV people are not even living unhealthy life. They are living a very fulfilled life, as long as they stay on their retroviral drugs. You understand? And make sure their level is suppressed. Their viral load is suppressed. You get it? So for your own sanity, for your own sake, for your own mental health, But yeah, so that's why you do colonoscopy. So this is what happened. Just like when I do it, and 39, they thought, oh, my tissue is, so they send me in to do my first mammogram before I turn the actual mammogram age, 40, right? And I'll tell you, even with the time, you never know, that also may change. Just like the colonoscopy. The colonoscopy used to be like 50, now it's 45. You get it? So they may also change depending on what standards of practice present. Maybe too many young people are having breast cancer and stuff. They may decrease it to 35. You understand? So yeah. So when they did it, it came out normal. And I like to go back to the same place to get it done every year, so that they have my baseline ultrasound and my mammographic result there. They can compare to the previous one. I'll tell you what happened 2021 or so, or 2022. I'll tell you. Hi Merv, how are you doing? Merv, I love that song you did. That was a beautiful song. That was a very inspiring one. God bless you for your strength and for putting that out there. I think you should really get someone to promote that song. Yeah, you should do something with that song. Wilbur, how are you? Is that Wilbert? Did I pronounce your name well? Mina. I scrolled up for a second. There was a nerd talking about his nightmares, like, okay. All right, someone is talking about their nightmares, then they need to talk to their psychiatric doctor. Their psychiatric doctor have options of medication that will suppress the thoughts and make you sleep. Okay, there are a range of medications that could help. So you need to talk to your psychiatrist. And you can also talk to a psychotherapist that will help you to manage and suppress the thoughts. Okay, but you can also watch other YouTube videos here that helps people on PTSD, how to suppress their thoughts so it doesn't take over their lives and doesn't cause them to go all night without sleeping. Yeah, because I don't think that... You're welcome, Mev. House right back at you. You see that? So it's good to have your like I said, the mammogram. So when they did it, if something were to be wrong, they will take a biopsy. What is a biopsy? You are back. Yes, I was answering your question. So this whole video came with this. I had a call. Sorry about that. Is that you or somebody that asked what if the person is taking medication, what they should do? Yes. So I was talking about the different range of medications you should stop taking at least 48 hours. One of them is Xarelto, Coumadin, aspirin, even NSAIDs like Advil and all those things. Stop taking them at least 48 hours before your colonoscopy. The morning before your colonoscopy is not one of those that they don't want you to take your blood pressure medicine. So if you want to take your medication, they said you can do it. My GI doctor said you could do it at least 2 hours before your procedure. Don't take anything, not even water. But when you wait, if you really want to take your medication first thing in that morning, if you are a person that have anxiety, you are on propranolol, you are on anxiety medication. Propranolol is a blood pressure medication, but it is used off-label for anxiety. Let's say you have test-taking anxiety, you have social anxiety, and there's a public event you are going to, and you want to take that. Don't take it because EPA is saying it here. Oh, talk to your doctor. Oh, talk to your doctor. Good. Talk to your doctor. Okay. Let me get that video. Talk to your doctor. Yes. Talk to your doctor before you take any medication, depending on what type of medication you are taking. People are taking cancer medications. If you are taking cancer, say, would you even want to do a colonoscopy? I don't know. The doctor will decide. You and your team of doctors, your oncology doctor, your primary care, everybody. And then, of course, you probably will be seeing a psychotherapist or psychologist too, or psychiatrist, depending on how it's all affecting aspects of your life, So, but I'll thank you guys, because since I started talking, I think I started feeling, I was very stressed, very overwhelmed, and very hungry. But as I'm talking, I think the hunger is going, because I really don't see myself sitting here right now and be taking this for breakfast and be drinking this and be drinking this, all sugar based, and water. How much water can I take? I was very angry this morning. I woke up stressed, but the first thing I did to ease my stress is bath, obviously. You see, I bathed, I applied my serums. You can see my acne is gone. A week ago or so, I had a bump here, but thank God that is also going. Yeah. Oh, well, now I have to go. Okay. All right. Have a good day. And be yourself always. Don't work to be other people, okay? I am myself. I like your name. I am myself. Continue to be yourself and stay out of trouble. Happy Sunday to you. Don't forget to subscribe and like before you go. Okay, like the video, guys, to support. So, like they do the biopsy, they take a tissue of your breast tissue to go and check it and see if it's cancerous. Same way I had dermoid cyst removal. That's also, they're going to take a piece of it. It's called biopsy. Just like they will see the polyps, if they see it. It's not everybody that they see polyps. We'll come back to the GI thing. They took a piece of the substance that they collected from, my uterus, my fallopian tubes, to the lab to check and see if I'm at risk for cancer, and it's benign. I don't have any risk of cancer. Thank God. So you see why it's good to do. And how did they find the dermoid cyst? When I went to see my orthopedic doctor, I have a very bad back. So when I saw the orthopedic doctor and they did my MRI, then something popped up on my MRI. You say, have I what? What do you mean? Make yourself understood so that I can respond appropriately. Bye. Have a good day. So you see, the same thing. We talk about the breast tissue. We talk about the cyst, dermoid cyst. If you want me to talk about dermoid cyst, I can talk about it. I did not know the extent to which people have this thing until it happened to me. My surgery was approaching and I had to. So screening is important because I am very particular on screening. When the doctor says something, I'm on it. Doctor says I'm on it. That is how they found out I had dermoid cyst. It showed up on my MRI. That is meant to be my spine. But don't forget, that pelvis MRI is for your spine, your waist, your pelvis. You get it? So whatever is sitting in there, your fallopian tubes, your uterus, everything pops up on there. You still here? I'm on my phone. That was my brother who said bye. Oh, okay. Someone said bye. So it's like two people were on it. Okay. All right. Thank you for clarifying that. So you see that. So the same process with the GI, the colonoscopy. You go in. Before you go in, like we talk about, abstain from anticoagulants. They are blood medication that puts you at risk for bleeding. Why are you on it? You are on it because you probably had surgery and your doctor don't want you to have blood clots. It's important that you stay compliant to all your anticoagulant. Speak later. Epa, have a happy Sunday. Sure. Because of my YouTube people, I'm repeating myself so much. Yeah. Have a wonderful day to Miss Julie. So you see, because I ended the first video and I came back again with started a new video on YouTube. So you have AFib. If you have AFib, meaning that your heart function is not good, and it's not regular. It goes up, then comes down. It's not stable. It doesn't stay. If you do your EKG, it doesn't go rhythmically. It goes. It's all over the place. So your blood is not pumping in and out of your ventricles appropriately. It can become a stasis that sits in the bottom of the ventricles, the valves. It sits inside, and so it can become stasis. It can develop blood clot, like how you put this there. It sits, even if you put a mixture there, like a tea, Milo, right? Hot chocolate, and you sit it there, then it settles in the bottom. That is what is happening in AFib. You get it? So when you take the anticoagulant, it melts the blood and it prevents it from getting that clot on the bottom of your ventricles, right? Guys, you guys think I'll become a good message professor? Yeah, I hate message because it's too much work. The reason I didn't do FNP and did psych, that's the reason. I don't want, not that I don't know my stuff, or if I study, I wouldn't know. I just hate that I have to be all over the place, be looking at your CBC, BMP, this, that, when I can just order thank you so much, JR channel. Thank you. Guys, follow JR channel. Thank you for the 2, is that pounds or euros? The one that looks like E with a sign in it. Is that pounds? Thank you for the super chat. God bless you. So you see what is happening with your cardiovascular system. I can tell you guys, if you want me to discuss something, go to Instagram, @epa_wewa, and leave me a question in my inbox. I'll come and teach you. Okay. But I will not genuinely just come here and sit and be teaching. I'm tired of that. It's not paying my bills. But when I'm chatting like this, I love it. So if topics come up, we have to learn. We will learn. Okay. So that's what is happening when you have AFib. So you will need to be consistent on your anticoagulant that the doctor wants you to have. Eloquase, what's the one that Miss Ari put here? What's the name again? Xarelto. Coumadin. Coumadin is one big one. And Coumadin, you need to follow up your labs. Do your labs. Don't skip your labs. When the doctor wants you to take it, please take your labs. Okay, take your lab work seriously. Take your medication seriously. Be compliant to your medications regimen. If you have to set an alarm, please do it. Okay. So you see the reason why you're on anticoagulant. You have AFib. You have surgery. You have PE. You have different things that need you to be on this medication. But if you don't take it, and that clot moves away and gets to your lungs, you're going to have pulmonary embolism. And you can look it up what that causes you. If that lump dislodges and goes to your brain, you can have ischemic attack. So you see someone, they are healthy, all of a sudden they said, oh, yeah. They sleep, they didn't wake up. They probably had a heart attack in their sleep. They probably, something dislodged, you woke up with stroke. Of course, if you go to, then they do MRI, CAT scan and all that, they'll probably find out how long you had this procedure, how long that you had a heart attack. They can take your cardiac enzymes and find out how long this took place. So depending on how long it happened and you couldn't get medical attention, you can end up being unalive. You can end up going through other things, you see. So 2 reasons why you should always be compliant with your cardiac, your anticoagulants. The risk of having heart attack, the risk of having stroke, the risk of having pulmonary emboli, the risk of having many things. If the clot dislodges to even your periphery, guess what? It comes when it blocks here. You see, when it blocks here, guess what's going to happen? It means blood will not flow from here to the bottom. So you're going to see where the tissue down there is going to start black, or you have peripheral vascular disorder where your legs start looking black. That is poor circulation. I will tell you, frequent walking, exercise. Africa, my mom said that you should be walking barefoot. As old as she is, she will be walking barefoot on the gravels. It's all to massage, to cause circulation, to stimulate blood circulation in your feet, in your legs. It's always good to walk, do stretching exercises. Those, we undermine them, but they are very effective. When I was trying to do my stomach, I don't like to lose my nyash, so I don't do my exercise. It may look ineffective. It is very effective. It's affecting my whole body, where my whole body was losing weight. So implement those little stretching exercises. Another reason why you will be, so we're on, if you are not taking medication, the medication as supposed to be, what can happen, right? But another reason why you may be put on anticoagulant, in this case you may even be put on Lovenox, the shot. That one is not, it's not permanent. It's like maybe for a few months or a few weeks or whatever, depending on when you had the surgery. You have become sedentary. You are not moving a lot, so they'll give you like those people who go and do the BBLs. I'm sure the doctors put them on medication after the surgery, because if you don't, you're gonna have clots, blood clots, emboli can formulate somewhere, and it can become a risk. So it can affect any part of your body. One thing I worry about is the PE and the stroke, ischemia, your tissues death in your brain. So yeah, that is what happens. So now with the GI, reason why if you are on those medications, you shouldn't. They are going to, you have a risk of perforation, I said it already, and you have a risk of bleeding. So you should stop taking the medication 2 days at least before the procedure. Okay. Now, like I talk about the biopsy, and also the dermoid biopsy. With this also, If they find polyps, they will remove them. But when they remove them, they are also going to take a piece. I'm coming to it in a minute. A piece and take to the lab to check your risk of colon cancer. If that substance have, have a risk, they have the numbers, the range, the normal range, the abnormal range, they will detect it and then let you know. I believe that, I think this is true, but I don't know the duration because I didn't read much about that. If they find out that you do have polyps and they remove it, even whether or not the lab comes back, okay, if the lab comes back as normal, they will not let you wait for 10 years to do another colonoscopy. They will do it sooner to check if the polyps are back and if they are at risk again. So they will follow up with you more sooner than the 10 years. But if it come back and it's positive, then you know that you are at risk for cancer or this, then that also maybe, what's the name? Chemotherapy or radiation therapy, whatever they will do for you, that also is there. Another thing that they will do, if you are not at risk, your values are back, everything is normal, they do the follow-up one. You have polyps, they remove it, they did the lab, is normal, they will do it sooner than 10 years. Take note of that. However, after they do it sooner than 10 years and they find out that you don't have polyps anymore, then from that day, you won't have to do it again till 10 years later. You get it? So hopefully, there is no polyps. If there is, they remove it, but that also means that they will do it sooner than the 10 years. So hopefully, I saw someone who said the first one, they had polyps, it was non-cancerous, then they did it again a few years later. Then after the second one, there were no polyps. So then now 10 years after that. So hopefully there is no polyps. If there is no polyps, then I don't have to worry about this stress because I want my food for another 10 years. So 56 years from then, we're going to worry about that. But yeah, the fact I have to live and my brain is stressed, I'm stressed, internally stressed, and not eating and have to depend on this is kind of stressing me. I want to read comments, but this thing, when the persons brought the support, I haven't seen any more comment again. Okay. Oh, I'm a nice person. You too, you are a nice person. I am myself. You too, you are a nice person. Thanks for coming. Okay. When I was plugged with pain in my feet, one of my co-worker told me to walk barefoot while in my house. I did, and it helped with reducing the pain. Yes, I will tell you that. I hate to be barefoot because I hate when, especially when you finish bathing, I hate to feel dirt on my feet. If you are here, if I go to Ghana, I will be dressed, walking and have socks. Even if I have my fancy shoe, I will still have socks on my feet. What's your face oil? What on your face? Oil? You want some to cook with it? It's not oil. I had serum and I have moisturizer on, and that's it. But I have natural oil secreting from my skin, and that's okay. All right. But yeah, how are you, Pauline? I hope you're okay. Just joking with you. Okay. Yeah. So put on your socks and walk on gravels. If you're in Africa and you have those gravel they use for the pavement for inside your house, you have like the lawns or the landscape person, they design your compound. Please get out of the house and walk. It's luxury for you to walk in America, but in Africa it's not luxury. Get up and walk. You got no job doing anyways. Yeah. So yeah, it's important to understand that those little things we don't consider as helpful, they are. It helps. Like those stretches, you see, I'm not an expert when it comes to exercising. I lost weight doing that. The stomach went down. It wasn't shooting out. And I lost weight overall, my whole body, my arms. You know, I hate to lose weight on my arms and I hate to lose weight on my nyash. But I hate to lose weight on my boobs. So when that little exercise I was doing, I lost weight all over. My boobs lost weight, my nyash lost weight, my stomach lost weight, like you will lose it. So now I am trying to get myself in the mental space where I shouldn't worry about that. I should worry more of why am I doing it? I was doing it so my stomach would go down so I can be sassy in dresses because I'm a dress girl. I'm not a trouser girl. It's difficult for me to dress with the trousers. Then I have to find the pieces that goes with it. But if I pick one dress, find 9 shoes, I'm good, you know. So that's the issue for me. I wanted my stomach gone. So now I'm preparing myself. Why am I doing it? Am I doing it to look good, or I'm doing it for health? You get it? I need it for my cardiac health. I need it for my cholesterol health. But for my lipid panel, you know. But truth be told, I think I need it. I wasn't doing it for that reason. I was doing it for my figure. So maybe I will just do the surgery, tummy tuck, the diastasis recti, whatever, to tighten my abdominal muscles and cut the fat away. And then when I heal, I will do exercise so that I know I'm doing the exercise for health versus for my boom. So let's eat our first meal of the day. This is what the doctor wants us to eat. So give me a minute, let me get a spoon. Give me a minute, let me get a spoon or fork or whatever. You know. I love that we got this chest back up, and pray for me to survive because I don't know how I'm going to survive this one. Yeah, I think I'm going to buy more. It tastes like, I don't like artificial flavors. I don't like artificial flavors. So it tastes like that sugar, like artificial flavoring sugar, whatever. Yeah. So this is my breakfast for today. These people are not serious. These people are not serious. These people are not serious. Let's see if we are going to survive this. Can you imagine? And I'll take my baby boy too. Oh, don't forget, I have Buy Me Coffee too. Guys, Buy Me Coffee. Go to my Buy Me Coffee link and buy me coffee to support me, okay? All right. Cheers to healthy lifestyle. So I mixed a little bit of apple juice with the ginger ale. I don't know. I don't like sugar, so I don't know how I'm going to survive on that. I was getting very stressed this morning. So how often do we have to? So what I'm going to do, I'm going to eat the red ones early parts of today. Towards the end of the day, then I'll start eating the much clearer ones. Yeah. And tonight, I think 5 o'clock, they said I'll take my medicine. I'll take my medicine. I guess if I don't do live with it, I'll sit down and record it. Because I don't know if I will be available. Yeah. So yeah, I'll eat this once. I don't know. And I'll save these ones for later part of the day so that maybe by then the colored ones will start getting out of my system. Yes, so that's how you prepare for your colonoscopy. Discuss the medicines you are taking with your doctor. We are in 35 minutes on YouTube. So I'm going to end this live, okay? It's too long. God bless you guys. Don't forget to subscribe before you leave.